viewers, welcome back. Today's topic is wheelchair and its parts. Let's start with the most important part of the wheelchair, which is the brake. On either side of the chair, you'll see the small handles to lock the chair in place. You pull the lever up to unlock and the chair would start moving. In order to lock the chair in place, you push the lever down and that would lock the chair. Pull up to unlock, push down to lock it. Always remember, keep the wheelchair locked at all the times unless you're ready to move. For example, if you're reaching for something, if you're bending over to pick up stuff from the floor, keep it locked. If it's moving, you can slide and fall. The armrests in this chair are desk length for convenience with work or during the meals. This type of chairs can fit easily under the table. And these are also adjustable. So you see this lever on the side? You can press the lever to move the armrest up. This is easy for the patient who have trouble with the transfers. Let's say they are transferring from the wheelchair to a commode or to a toilet. The person can just stand up and turn around to land safely on the destination surface compared to the armrests that are fixed and that cannot be flipped up. In order to lock it in place, you move it down until you hear a clicking sound to ensure that it's locked. Now, these are anti-tippers. Anti-tippers are recommended for the patients who frequently present with posterior balance loss, who has poor trunk control, or patients with dementia. The anti-tippers will stop the chair from tipping backwards and thereby prevent the patient from falling when there is unexpected backward thrust. Another advantage of the anti-tippers is the ease when going up and down a step or a curb. So you put your foot against the anti-tipper and gently pull the chair back. The chair will easily tip backwards, so you can push the chair up on a step or on a curve. And then you can move it down once it's off the curve. These are caster wheels. They can rotate 360 degrees and therefore a standard wheelchair can be used indoors or outdoors. This is the leg rest of the wheelchair. So let's put the leg rest in. You see these holes on the sides? This holes fits easily in the elevated part of the wheelchair. So there is a lever on the side. When you pull the lever, the leg rest will become loose and it can swing out or in. In order to lock it in place, you push the lever in until you hear a clicking sound. This part is the foot plate. You can flip the foot plate up or down as and when needed. It's always recommended to keep the foot plate up when someone is trying to get up and move from the wheelchair, just so that their foot doesn't get caught and they don't end up with the injuries. In order to adjust the height of the leg rest, I'm going to turn it upside down first. You see this black lever? You pull the lever up to loosen the leg end, and there are two small dots on either side right above the leg pad. You press these two dots together and you can either pull or push the lower part depending on if you want to lengthen the leg rest or if you want to shorten it. Once adjusted, you push the lever back in place and the leg rest is ready to use. Then put it inside and check if the length is okay, or if you need to readjust, you can do it again. These are the rims outside the wheels. Patients with weaker lower extremities can propel the chair using their hands. Let's see how to take the measurements for a wheelchair. To measure the width of the chair, take the measurement from one handle to the other. To make sure that the patient fits properly in the chair, you subtract 2 inches from this measurement to ensure that there is enough room for the patient to wiggle around and it's not fitting tightly, that is compressing on their soft tissues. To measure the length of the chair, you take a measurement from the back support to the front of the seat, and you want to subtract 1 inch just to make sure that there is not too much pressure on the popliteal area when the patient is sitting on the chair. When considering the height of the chair, always keep in mind whether the patient would be using the seat cushion or not. To measure the height, you take the measurement from the seat down to the floor. Now, if there is cushion on the chair, that is going to increase the height of the chair. So you take the measurement and then you add 2 inches to make sure that the height is proper and the patient's feet won't be wiggling in the air when they are sitting on it. Let's talk about the differences between a standard wheelchair and a transport chair. The standard wheelchair has brakes at the front and on either side. In contrast, a transport wheelchair has brakes on the rear end, and it's hard for a person to reach the brakes and lock, and therefore it's always advisable that a caregiver pushes the patient when using a transport wheelchair. The other difference is the transport wheelchair has fixed armrest and they are always full length. Transport wheelchair is much lighter compared to a standard wheelchair. Therefore, it's easy for someone to lift it and put it in the trunk when going outside. Also, the dimensions are narrower compared to a standard wheelchair, and therefore the transport wheelchair fits easily in most of the cars. Please let me know if you have any other questions related to the wheelchair, its parts or its measurements. You can put them in the comment section below. And if you have not subscribed yet, please subscribe to my channel to see health and therapy related videos. Thank you for joining.